Hello, my name is Dvorak, and I'm a clinical psychologist and chronic pain specialist. In this brief video, I would like to explain to you how I might be of assistance in completing your pain or chronic pain management. When human beings experience pain, an automatic reaction will be triggered. The automatic reaction means emotions, thoughts, and urges. Emotions such as frustration, anxiety, feeling overwhelmed, maybe helpless, hopeless, especially if pain has been dragging on for a long time. And of course, the urge to avoid pain. We can summarize all these human, natural, automatic reactions to experiencing pain as suffering. It might be an old-fashioned word, but it's not a bad word to describe what is happening for someone who has to deal with pain. These natural human reactions to pain are not a problem in themselves as such, but they are a problem because they have been found to make pain itself worse, and they also facilitate and increase the negative impact that pain has got on someone's life, especially when it comes to chronic pain. You may wonder how psychology can be helpful above and beyond already working with doctors, physiotherapists, or any number of health professionals. How can psychology complement medical pain management? That is a valid question. Traditionally, psychologists have provided a lot of what you call relaxation training, particular forms of breathing or using your body or imagery to try and be more relaxed, as being tense, which is part of that automatic reaction, is also making pain worse. So relaxation would be the antidote for that. Then psychologists have worked a lot using imagery. Imagery either to provide some distraction from the pain or to directly try and modify the pain itself. So traditionally, psychologists have been involved in that part of pain management that is about directly trying to reduce the pain. Methods such as relaxation or distraction or imagery can be quite useful when dealing with pain. However, there are also some limitations, especially when it comes to chronic pain. In the last 20 years, newer forms of psychological interventions, especially for chronic pain, have emerged. And the most prominent of those is called psychological flexibility training, which is something I have been doing for more than 20 years in my work as a clinical psychologist. Psychological flexibility training is about minimizing these natural and automatic reactions that as human beings we simply experience when there is pain. And it is possible to find ways to dial down, to minimize those reactions. When a pain patient has been able to minimize their natural reactions to pain, that will also reduce the impact that pain has got on their daily life. It may change the quality of the pain, and it may even reduce the intensity of the pain. In short, minimizing your reactions, these natural reactions to pain, carries a very good chance of reducing significantly the suffering that is usually associated with experiencing pain, especially chronic pain. So psychological flexibility training is an educational intervention. This is not traditional counseling or psychological therapy, which I'm also able to provide if and when the chronic pain patient desires to engage in a counseling process. But in itself, psychological flexibility training is an educational intervention. It is about skills training, and it is about changing how your brain and your central nervous system is processing pain. This is something that is known under the name of neuroplasticity. Psychological flexibility skills training does not take an endless number of sessions. There are only very few sessions necessary to get across the practices, the techniques, what you need to know to make this neuroplasticity happen for your central nervous system. Patients working with me in this framework will also receive comprehensive support materials, including instructional pre-recorded videos to which you will have unlimited access. If this makes sense to you, if you are interested in working with me, either on the traditional relaxation, distraction, imagery-based techniques or in regards to psychological flexibility skill training, please don't hesitate to contact me. You can find me on the HealthPoint Health Professional Directory. You can contact me through the bewell.co.nz website. You can send me an email to completepainmanagement@gmail.com, or you can send me a text or leave me a message on my work phone. If you're interested in getting more information about psychological flexibility and chronic pain, there are more videos that you can watch in which I will talk to this theme in greater detail and greater lengths. Thank you.